So welcome to the February webinar for the financial security community. And our topic today, healthcare during the senior years. We're so delighted to have with us Jesse Ketterman, who is an extension educator with University of Maryland, and Maria Pipides, who is County Director and Extension Educator, University of Delaware Cooperative Extension Service. Maria has been a member of this community for a long time. She started in 1992 with University of Delaware Cooperative Extension Service and conducts workshops on financial management, health insurance literacy, food safety, personal development. Her master's degree is in family resource management and consumer economics from Cornell University, and her bachelor's is from the University of Delaware in consumer economics. She is also an accredited financial counselor and a financial fitness coach. Dr. Jesse Ketterman has his bachelor's degrees and master's degrees in business, and his PhD is in educational leadership. And prior to coming to work for Extension, he had a career with the University System of Maryland and worked in student affairs and led their wellness-related activities. So he's been with University of Maryland Extension since 2016. And he's been recognized with the Extension Family and Consumer Sciences Educator of the Year from NEA FCS Maryland Affiliate Chapter. He's also a Distinguished Alumni Achievement Award from Frostburg State University. So we're delighted to have both of them here today. When I was looking at a little background on this, and if you haven't ventured a guess yet, the population in 1950, ages 65 and older, was 8%. And right now it's right around 16%, or that was the number in percentage in 2017. And it's anticipated that by 2050, the population age 65 and older will be 22%. So what we know about senior citizens, and I've been told at age 58 that I'm a young senior, we know that we are working longer and that we are more educated than previous generations of seniors. But we're also more likely to be divorced. We're more likely to have health problems. And there is a very wide economic disparity among this age group, which is expected to continue to increase. Long-term care costs are anticipated to rise, and also incidence of and costs associated with treating Alzheimer's are expected to increase. So this can be really critical information for the people we serve in our communities as we do outreach education in personal finance and consumer economics. So some of the things we're going to talk about today are what we need to know about healthcare, and particularly these costs during the senior years, where we can go for information about Medicare and those confusing supplemental health insurance options. We'll review the stages and the strategies and the tools so we can help seniors estimate their healthcare cost. And we'll have a case study that we're going to look at. That's on the resources page if you'd like to look at a copy of that while we're discussing it, and learn about the options that cover long-term healthcare costs. And these can be critical issues in financial security across the lifespan. So thank you so much for joining us today, and much appreciation to our presenters, Dr. Ketterman and Maria Pipides. Take it away.
As Laura mentioned, the program we're going to be doing today is health insurance in your senior years, Medicare and other options. This is one of several modules we have with our Smart Choice Smart Youth Health Insurance Initiative, which is a collaborative effort between University of Maryland Extension and University of Delaware Cooperative Extension. And as Laura had mentioned, my name is Jesse Ketterman. I'm from University of Maryland Extension, and I'm joined by Maria from University of Delaware Cooperative Extension. And Laura also mentioned we will be referring to the case study. So if you printed off a copy of that, that would be great, but we will be referring to it throughout the presentation. And we'll also have that document, how to compare Medigap policies and Medicare cost at a glance. So if you have those documents available, that would be helpful. So our plan for today, what we want to do is help you understand what you need to know about healthcare cost in your senior years. You want to know where to go for information about Medicare and supplemental health insurance options. review strategies and use tools to help estimate your healthcare cost, and identify what options there are with these plans to cover long-term care costs. And so all important topics as you're looking at your senior years.
We're going to just start out with kind of the framework with the way we sort of organize all of our smart choice and smart use health insurance programs. And we always kind of start out with the why. So in particular for this module, we're talking about why do I need health care after the age of 65? We're going to talk a little bit about the what, and specifically we'll talk about what is Medicare and what does it cover. You know, what are those important other insurance options, and how do I find out information? So what kind of documents are out there that help us make good informed decisions? And then we'll talk about the how. And specifically for this one, we're talking about how do I estimate my healthcare costs in my when I'm over 65, and how do I cover some of those long-term needs as I age. And so once we can answer all those questions, we'll be making a smart use of our insurance and be able to be covered with health insurance as we age. So let's start with our first why. Why do I need to plan for health care after the age of 65? One of the first things, sort of our team came up with is really to ensure you have the coverage that you need as you age, right? Not be a burden to the family is also some Pamela shared as an idea. And then, that notion that healthcare costs increase over time as we age, especially if we're dealing with chronic illness. So some of the topics or some of the reasons we came up with why it's important is really to ensure that you have the coverage that you need as you age. And that means really putting together, as you'll see, some of the pieces around, having Medicare, but then also what might be those supplemental policies and being sure that you really have the coverage that you need. And then getting the most benefit from your insurance coverage, meaning having insurance helps ensure that you have the benefits and access to preventative services like an annual checkup, and making sure that you're using those benefits, that to understand the benefits and use them. Understanding sort of those total out-of-pocket costs of health insurance. And so again, one of the interesting things that happens as we move into kind of the years when we are working with Medicare is we are it transitions, right? It transitions from what we're used to, which is having a healthcare plan that may cover my whole family, to the types of coverage where I'm purchasing insurance just for my own self. And so that would be Medicare and then any supplemental plans. So it's then kind of piecing together then all of those different cost parts to really understand what the cost of all of the plans are going to be for you and how that impacts your financial situation. And so obviously there's going to be out-of-pocket costs, not just the premiums, but the co-insurances or the co-payments, and really beginning to understand what that means as you transition and use the different medical plans, and then really to determine if you have chosen the right plan to fit your financial situation, but also your health situation. So one of the other key questions to answer is, what is Medicare and what does it cover? Well, Medicare is a national health insurance program in the United States. It began in 1966 under the Social Security Administration and is now administered by the Center for Medicare and Medicaid Services, or CMS. It provides health insurance for Americans age 65 and older, but it also can provide coverage for younger people who have a disability status as it's determined by the Social Security Administration. So people qualify for Medicare coverage, and Medicare Part A premiums are entirely waived if the following kind of comes into play. And so for people who are 65 years and older and US citizens, or have a permanent legal residence for the last 5 years, they or their spouse, if they have paid Medicare taxes for at least 10 years, they also talk about it in 40 quarters, so it doesn't have to be consecutive, but at least 10 years or 40 quarters, then you're eligible for Medicare. Another qualifier is that if you're under 65 and disabled and have been receiving SSDI benefits, right, or Railroad Retirement Board disability benefits, then they may qualify for early enrollment in Medicare. And another qualifying category would be if you are getting continuing dialysis for end-stage renal disease or need a kidney transplant. So that's a little bit about what Medicare is, and we're going to talk more specifically about what it covers. So there are 4 parts to Medicare, and they are described as Part A, Part B, Part C, and Part D, which frankly I think confuses people. But Part A really focuses on inpatient hospital coverage. And so this includes things like inpatient hospital stay, and kind of the services that are provided when you're in the hospital. It can also cover home health care and some skilled nursing care. So that's Part A. Part B covers things like doctor's visits and outpatient services and diagnostic screening. So it's really everything that happens outside of the hospital. Part C is what they call Medicare Advantage. And this is an alternative way to receive Medicare benefits. And Medicare Advantage plans are often offered through private health insurance companies. And when you join a Medicare Advantage plan, you still have Medicare, but the difference is the plan covers and pays for your services instead of the original Medicare program. And so these plans must provide the same coverage as original Medicare, so you're not missing out on anything, but they can also offer extra benefits like vision and dental, depending on the plan. Part D is really about the prescription drug coverage, and it is also offered through private healthcare plans. I wanted to talk a little bit about some of the costs and what does Medicare really cover, and what might be some of those out-of-pocket costs too. So on the screen right now, and this is sort of a chart that comes from a document that we shared with you called Medicare Costs at a Glance. And so this will be in the resource, on the resource website. But you can see on the left-hand side the Part A premium, and it talks a little bit about what the premium would be if you have not paid into that 10 years worth of Medicare contribution over your work life. So as it says, most people don't pay a monthly premium for Part A. And so that's great for those of us who've contributed in, but for those people who haven't, right, and there may be some, they would be expected to pay $458 each month, right? And that rate changes every year. So that's important to recognize. And if you paid Medicare taxes for less than 30 quarters, then the standard is that $458 per month. But if you paid Medicare taxes for that 30 to 39 quarters, then the standard rate is $252. So again, that's important to know and recognize as we're working with our clientele. But Now I'm going to go to the second row where it says Part A, hospital inpatient deductible and coinsurance. So we may not be paying a premium for when we visit the hospital, but we are going to be paying a deductible and a coinsurance depending on our length of stay in the hospital. So notice then that it says you would pay $1,408 deductible for each benefit period. And so one of the things that's different than what we think about as the year, right? Usually we have an insurance coverage and a deductible that is by the year. When we move into Medicare, it is by a benefit period, and it is defined, right? So that if I go into the hospital as an example, and I might be there for 30 days for some sort of event, and then I leave the hospital, and then later on in the year, I revisit the hospital, I would be paying that deductible twice, right? And I would be paying the per day rate for each time I'm in the hospital. So that's a little bit different, and it's important then to recognize in terms of our financial planning the kind of dollars we're really kind of talking about here. For Part B premium, right, so this is the all outpatient and diagnostic services that we might need. There is a premium for that, and this year it is $144.60 per month. This is the typical amount or the premium that comes out of the Social Security check directly. And again, in Part B, there is a deductible and coinsurance. The deductible is $198, so not a large amount, but there is also that 20% co-insurance that is expected for really any time we're using services. So again, that can kind of add up depending on your healthcare status. Part C is there is a monthly premium, and basically you're having a contract with a private health insurance provider, and you're paying that premium every month. And the same goes with Part D, which is for the drug plan, right? So Part C is your Medicare Advantage plan. It's a separate insurance policy, and Part D then is for your drug policy. And you can see there is a website there where you can get the information for the Medicare at a glance information. So one of the things that's really important to know about Medicare is they expect you to sign up on time. And there is an initial enrollment period that lasts is sort of this window between 3 months before your 65th birthday and 3 months after your 65th birthday. So the first go around is really open enrollment. You can enroll at any time during the year. And it's important to be within that window, because if you're not, then they issue penalties that can last you until you pass away. So October 1st then is when we start seeing all the advertising on television, right? And this is where we begin to update for the next year, kind of re-enroll in our supplemental, but it's also a supplemental or Medigap plan, but it's also when the website for Medicare is updated for the subsequent year. During that October 15th to December time period, that is open enrollment. And this is really where you can make changes to your Medicare or prescription drug plan. So for example, if I signed up for a Medicare Advantage plan and I've decided, gosh, this isn't really working, I want to switch over to regular Medicare, this would be a time when you could do that. It would also be a time when you would make some decisions or changes about that Medicare supplement plan or your prescription drug coverage plan. And then as you can see, the medical coverage then starts January 1st. But let's just talk about Medicare Part C or Medicare Advantage plans for a second. They are like typical kind of what we know of as health insurance plans. They are like HMOs or PPOs, and you'll actually see that language when you are comparing plans. It includes all the benefits and services covered under Part A and Part B, and the plans are required by law to do that. And it oftentimes includes that Medicare prescription drug coverage as part of the plans. Sometimes they also include extra benefits like vision or dental. And so you are paying then the premium to have that plan. Plans typically have a yearly out-of-pocket limit for medical services, which can be very helpful. And they are run by Medicare approved private insurance companies, and they have to follow Medicare's rules. So the next what question is, what are my other insurance options? And so since Medicare doesn't really cover everything, right, the deductibles and that 20% coinsurance, many individuals decide to have a supplemental or Medigap plan. And these come from this may come from a current or a previous employer, or it can come from policies that you purchase that are available in your area. And the Medicare website, I have to say, is a pretty excellent website. It allows you to put in your zip code, and then you can identify those drug plans or the Medicare supplement plans that are available in your community. What do they cover? So they're designed to wrap around and supplement the Medicare original plans. And it really kind of depends on the type of plan, but they're standardized, and we'll talk about this in just a second, but they're standardized to really help people comparison shop across different insurance providers. There are different types of insurance, meaning there are PPOs, EPOs, and HMOs, right? Preferred provider organizations, exclusive provider organizations, health maintenance organizations. And so it really depends on the insurance company, what they offer and whatnot. And this is also one of the handouts that was provided for you. But these are kind of the way these supplemental plans are organized, and they're standardized. And so every Medigap policy has to follow federal and state laws that are designed to protect you, and they must clearly be identified as Medicare supplement plans. And they can only, an insurance company can only sell you sort of the standardized policy that are based on the letters. So as you look at this slide, you see kind of an alphabet across the top. And that is the way the plans are identified. Is it a plan A, a plan B, a plan C, a plan D, etc.? And it will tell you that. All the plan policies have to offer the same basic benefits, meaning if I'm comparing between Health Insurance Company 1 and Health Insurance Company 2, and I'm looking at a plan A, both of those companies have to offer all the same benefits. Once you know what kind of plan you're looking at, it's easier then to compare across companies. So as you're looking at this chart, one of the things that you can see is the first row. It talks about Part A coinsurance and hospital costs up to an additional 365 days after Medicare benefits are used up. So as you look at this chart, all the plans, A, B, C, D, etc., cover that. So what that means is, if no matter what plan I choose, an A, B, C, D, or F, from no matter what company I purchase it from, they're all going to cover that coinsurance and deductible. So when we think back to that other chart where it said, oh, for days 1 through 60, I have 0 copayment, that I might be in the hospital. But from days 60 to 100, I have to pay $80 a day, right? These plans will cover all of those costs up to 365 days. I hope I'm clear. Notice in row 2, it says Part B, right? Part B, coinsurance or co-payments. So once we get to row B, or sorry, that second row, you'll see that some of the plans, most of the plans cover. Now remember that Part B, that's all outpatient things, all outpatient services. And that is where that 20% coinsurance kicks in, meaning we would have to pay 20%. What this is saying is if I buy a plan A, B, C, D, F, G, M, and N, all of those costs would be covered. If I choose Plan K, they will only pay half or 50% of that coinsurance and deductible. And if I choose Plan L, that would pay 75% of that coinsurance and deductible. So I hope that I'm explaining how to read this chart. As you go down the chart, right, you can begin to see that kind of less or fewer of the policy choices are not covering all of the costs. So you may have heard that many people choose Plan F or Plan G because they cover, as you look, a lot of the different expenses. Obviously, because they do that, they are the more expensive plans. So as a consumer, you need to think about what are the services, the healthcare services that I might be using, and what am I willing to cover personally from my own savings versus what I need to cover through Medicare and then that Medicare Supplement or Medigap plan. So I'm going to pause there and just ask, are there any questions? Type them in the chat, and then we'll try and cover those, and then we'll move on to the next section of our workshop.
Maria, it's also important to point out there, if you see that category of foreign travel, and so if you're someone in your retirement that plans on traveling a good bit, you know, you want to make sure that you have that Medigap policy that's going to cover some of the healthcare costs if something should happen to you while you're in foreign travel.
Yes, thank you.
So the next question we're trying to answer is, what documents provide information? So where can you go for information if you have questions? And first document is your insurance card, right? Your insurance card is going to give you information. It's going to tell you a little bit about your plan, your group name, member services. You know, all that information is available on your medical card. And usually there's also a number that you can contact if you have any questions. Now, when it comes to your Medicare card, the best place to go for information is the Medicare.gov website. So, but your Medicare card is something you should carry with you. I know there used to be concerns about your Medicare card having your Social Security number on it. They have moved away from that. So at this point, I don't even think there's anyone, even people that have had Medicare for a while, that will still have a card that has their Social Security number on it and should have a Medicare number. And then the other document is your evidence of coverage. And that is kind of like your contract between yourself and the insurance company. So it gives you that detailed information about what the plan covers, the cost, and what to do if you need to dispute any charges. And so that's, again, like your contract. And as I mentioned earlier, the Medicare.gov is where you go. They don't have an evidence of coverage document that they would mail to you. And so you go to the website for information for Medicare.gov. Now we're going to get into how do I estimate my healthcare costs, which is going to take us to the case study. So I'm hoping you're able to pull that up. We have the Terry family, and so we have Terry, who's 68, and Drew, who's 67, and they're a couple on the go, and they're relatively healthy. They both have Medicare prescription drug and supplemental medical coverage. After reviewing healthcare expenses and explanation of benefit documents from last year, Terry noticed there is an individual deductible for Part A of $1,340 and Part B $366. And again, that's because there are two of them, and so you'd have to multiply that by 2. Because of the Medicare Supplemental F policy, the only additional out-of-pocket expenses will be for co-payments for their medical cost. Each family member visited their primary care physician 4 times, including the annual checkup. They pay a $20 co-payment each doctor for each visit. Terry determined they paid 8 co-payments for 8 visits. Drew has allergies and visits an allergy specialist once a year and has a prescription drugs to help manage the allergies. Drew pays $30 for the office visit once a year and $15 for 90-day prescriptions 4 times a year. Terry and Drew wear glasses and go to an optometrist once a year for a checkup and each get new glasses. The vision copayment is $30 and the glasses cost $300 each. Terry and Drew each go to the dentist once a year with a copayment of $30. Terry pays a total of $268 a month for Medicare Part B premiums, $70, again, 2 times $35 a month for prescription drug coverage, and lastly pays $380 a month for Medicare Supplemental F policy. Terry also pays $80 a month for dental insurance premium for both of them. Although Terry has an emergency fund, Terry plans to set aside money for the full deductible and other out-of-pocket costs. Terry also realizes that with Medicare and with the supplemental insurance policy, there is no out-of-pocket maximum. Maximizing savings will be important. So let's see if you can pull up the case study. You should have a form similar to what you have on the screen. Walking down through that, you have your health insurance premium. We don't have a health insurance premium in this case. You have your vision insurance premium, which we don't have in this particular case. We do have dental insurance. The dental insurance from the case study would be $80. The prescription insurance premium would be $70. The Medicare premium is $268. The Medicare supplemental insurance policy, Medigap, would be $380. I know I'm kind of moving through this quickly, but I'm just sharing with you the numbers. If you wanted to kind of work through it on your own later, you're welcome to do so. That would leave you with a total monthly fixed healthcare cost of $798. So then you would take that $798 times 12, which would give you your total annual fixed healthcare cost, which would total $9,576. There is no annual deductible in this case. Out-of-pocket maximum, there's no limit. So now you get into those flexible healthcare costs. Those are costs that may vary from year to year. In this case, we had office visit copayments. We had 8 visits with a $20 copayment, which is $160 total. We have a specialist visit copayments, one visit, $30. So that would be $30. Now we would skip down to prescription drug copayments, which is 4 prescription drugs at $15 a piece, which would be $60. And so then we're down at the dental services, 2 dental services at $30. That would be for a total of $60. Vision exam copayments, 2 visits, $30 with a total of $60. Vision services and glasses, $600, which gives you a total flexible healthcare cost of $970. And so you can see that on the screen. Again, I was going down through line by line for you. I'll give you a second to write those down so you have that information. So the next step in the case study is to look at your monthly and annual out-of-pocket cost. And so one question there is, how much do I need to set aside a month, monthly over and above my premium payments to save for healthcare cost? You can see that we don't have an annual deductible. Total flexible healthcare cost are 970. 970 divided by 12 would then be 81. And then in box 3, the total annual fixed healthcare cost is 9,576. You would add that with your known cost of 970, and that's going to give you your total annual out-of-pocket cost of 10,546. So what are 4 tips that we can give you in terms of managing your healthcare cost? Make sure that you review your health insurance documents to understand your plan and its cost. Make sure that you estimate your co-payments, prescriptions, equipment, travel, and other costs, and calculate how much to set aside to cover out-of-pocket costs. And of course, you always want to shop around and to compare your supplemental and drug insurance plans each year.
So the big key question here, and this is what I've gotten a lot of questions about in terms of, clientele trying to understand, how does Medicare work? What do I need to do about long-term care? And people are really concerned about this. So, there's a lot to sort of think about. And, now that we kind of understand what Medicare and the Medicare gap insurance can cover, the next question is, what about this long care piece and how does that interrelate? So first, just a simple definition, right? Long-term care is a range of services and support for your personal care. And most long-term care isn't medical care. Instead, it's sort of taking care of those basic personal needs. There's those everyday activities of living, and that's what they kind of call it, right? That's what the medical field calls it. It may also be called custodial care. So it's really being able to feed yourself, dress yourself, bathe yourself, use the restroom, those kinds of tasks that aren't really medical, but as we age and lose capacity and capability, those are some of the needs. Unfortunately, Medicare doesn't really cover long-term care or custodial care unless it's medically necessary. So Medicare does cover things like care in a long-term care facility or hospital, right? Skilled nursing care in a skilled nursing facility, eligible home health care services, and hospice and respite care. So that's important to understand, because when you're talking about aging and chronic disease and or dementia or Alzheimer's, right, that does take skill, right? There is sort of medical assistance that's needed when we're managing chronic disease and or dementia. And so in that case, Medicare is going to cover some of that. The Medigap insurance is going to cover that. And if need be, Medicaid may cover that. So what really kind of are our options, right? So as I said, that Medicare and Medigap or supplemental insurance is going to provide skilled care. And so for people where it's medically necessary and they need those kinds of services, those 2 policies are going to help cover things. Long-term care insurance, right? That's really based on the ability to perform those activities of daily living, and they usually pay up to a certain amount each day. And so in this case, it would be an additional insurance policy that's really about custodial care in a long-term kind of care facility where it isn't necessarily medically necessary to be there. Nursing care and the long-term care insurance then would help cover that. One of the things that's new maybe in the last 5 or 10 years is this life insurance policies that have built-in long-term care coverage. So there are now life insurance, usually whole life, not usually, always whole life or universal life policies, where they allow you to use the money that is in those life insurance policies to cover long-term care costs. Obviously, as you use it, the amount of the life insurance available then to heirs, right, is diminished, right? So as you use it, the balance goes down, and then and then that is what would be offered to heirs after you pass away. For many people, they're using savings and or selling assets in order to cover these costs. And then last but not least is this notion of Medicaid and other state programs that are really designed for people who have exhausted their assets and are limited income. And so in those cases, then applying for Medicaid and some of those other state programs can help cover healthcare needs kind of no matter where you are, whether you're in your home or in some sort of assisted living facility. So where can we find out more information about Medicare and the supplemental plans? Well, as I said before, the Medicare website is pretty good. It explains Medicare and what it covers. It allows you to put in a zip code to figure out what supplemental policies are available for you, and you can also search based on what your needs are, like if you want to look at for an Advantage plan, a Medicare Advantage plan, or do you want to just look for a Medigap policy, or do you want to look for prescription drugs? So that's all kind of searchable within the Medicare website. One of the other really important resources is the Senior Health Insurance Program. It's the SHIP program. States might call it something a little bit different, but it's usually through the Division of Aging in your state, and these are individuals who are trained in Medicare and the supplemental plans, and they can actually sit down one-on-one with people and coach them through the process, help them make some choices, and help them better understand the insurance policies that would be available to them in their community. Clearly, the local Medicaid or Medicare office is a great resource. And then this is a website that helps sort of explain what long-term care policies are and how to connect with them.